Community pharmacists play a crucial role in patients' day-to-day lives. According to Pharmacy Times, patients have about 35 face-to-face encounters in community pharmacy per year versus only 4 face-to-face visits at a physician's office. Community pharmacists are also responsible for overseeing pharmacy technicians, pharmacy interns, and the pharmacy as a whole. Pharmacists in the retail store must verify that every prescription is correct and appropriate for a given patient. After the prescription is filled, the pharmacist must also make sure that the product filled is matched to the correct drug and correct patient. Community pharmacists also play a big role in providing vaccinations for the general public. Pharmacists can administer a number of different vaccinations, such as vaccines for the flu, shingles, and pneumonia. You will often find pharmacists in the over-the-counter aisles with patients in a community pharmacy as well. Pharmacists provide counseling for OTC medications, medical supplies, and other health supplies. Hospital pharmacists can have 2 main roles, either being a staff or clinical pharmacist. Staff pharmacists also oversee the day-to-day operations of the pharmacy as well as the technicians. They also work closely with nurses and medical doctors in order to clarify and verify orders before they reach a patient's bed in the hospital. The orders that get verified are placed in patient-specific compartments for nurse administration. These patient-specific drug bins are filled with their medications daily, and the pharmacy must make sure these orders are filled on time. Staff pharmacists also oversee the Pyxis machines, which are machines located on each floor and wing of a hospital. Pyxis machines are filled with medical supplies or common medications that are used in urgent circumstances or as instant add-on therapies. Staff pharmacists must make sure these machines are fully stocked at all times. Clinical pharmacists spend more time in different areas such as an IV room, the ICU, or different hospital wings. Clinical pharmacists may be IV certified and are responsible for verifying complex IV therapies. IV products may be either hazardous, such as chemotherapy agents, or non-hazardous.
Compounding pharmacists create specialized products for different patients or circumstances. Items compounded include suppositories, creams, gels, capsules, or injections. These products can be tailored for pediatric patients, elderly patients, or someone's pets.
Ambulatory care pharmacists work in clinics and manage chronic disease states, such as hypertension, diabetes, or psychiatric disorders. Ambulatory care pharmacists often meet with their patients at varying time periods, depending on their condition. These pharmacists may see their patients every week, every 4 to 6 weeks, or every 6 months. Pharmacists who work in clinics often become board certified in these different disease states. 36,000 pharmacists worldwide are certified in 11 different specialties. These specialties may be in cardiology, nuclear pharmacy, oncology, and psychiatric. Cardiovascular clinics manage a patient's heart medications as well as performs physical exams regarding their hearts. These pharmacists perform thorough cardiovascular exams, which include taking the patient's pulse, measuring blood pressure, and physically inspecting the patient for signs of further heart problems. Respiratory clinics have pharmacists who specialize in conditions such as asthma and COPD. These pharmacists also provide full physical exam workups, but are more centered around the patient's lungs. Respiratory pharmacists perform lung exams, which include listening to a patient's lungs and feeling for healthy lung inflation. Respiratory pharmacists focus on educating patients on proper inhaler technique. There are many inhalers on the market, and they all work differently, which can be confusing for patients. Respiratory pharmacists in their clinics take the time to teach a patient how to properly use their inhaler as well as assess how well the inhaler is working. All ambulatory care pharmacists spend extensive time counseling and following up with their patients' drug therapies. If you have a chronic condition, talk to your local pharmacist about clinics in the area that may be specializing in your condition. Long-term care pharmacists provide medications for elderly or disabled patients in nursing homes. Long-term care patients often only receive a 7 to 14-day supply at a time, and their medications are packaged in special blister packing to make it easier for nurses to administer daily medications.
Mail-order pharmacies are a great option for patients on long-term therapies, such as blood pressure or diabetic medications. Mail-order pharmacists will verify and send you a 90-day supply right to your front door. Mail-order pharmacies are also different because they cannot send patients a C2 controlled substance. However, mail-order pharmacy may provide discounts on patients' medication regimens.